Let's be honest. When was the last time you actually thought about your ankle? Probably not recently, unless, you've twisted it. But this joint is an absolute masterpiece of natural engineering, a true unsung hero of your body that you rely on for pretty much every move you make. So let's just start with a number that shows how much work it's really doing. 1.5 times your body weight. That's the force your ankle deals with on every single step. And if you're running, that number can jump to 8 times your body weight. I mean, just think about that. It's a staggering amount of pressure, day in and day out. So what is this incredible piece of biological machinery that can handle all that force? Well, it's the ankle joint, of course. It's that crucial connection that literally grounds you to the earth and gives you the freedom of movement. Yeah, we're calling it the body's unsung hero, and for a very good reason. The ankle is just fundamental to everything. It supports your entire body. It lets you walk, run, jump, and all the while, it's making thousands of tiny micro adjustments to keep you balanced. It really is the pivot point for your entire life in motion. To really appreciate how amazing it is, we've got to look under the hood. So let's dive into the anatomy of the ankle. We're going to build this thing from the ground up, component by component. So at its core, the ankle joint is this incredibly complex hinge. It's not just one thing. It's this sophisticated dance between hard parts like bones and the soft connective tissues like ligaments and tendons. They all have to work together perfectly to connect your leg to your foot. Okay, so the foundation of our ankle structure. It all starts with the tibia. You probably know this as your shin bone. It's the bigger of the two bones in your lower leg, and it creates the strong, weight-bearing inner wall of the ankle joint. Now, running right alongside the tibia, you've got its partner, the fibula. It's the thinner, more slender bone, and it forms the outer wall of the joint. So together, the tibia and fibula create this perfect, snug socket. And what fits right into that socket? The talus. You can think of the talus as the keystone in an archway. It's that central piece. This unique foot bone sits right in between the tibia and fibula, and it's what allows your foot to move up and down in that smooth, hinge-like motion. And just like that, we've built the main bony frame. But, bones are just the frame. To bring this whole thing to life, we need the connective tissues. So first, you've got the ligaments. Think of these like incredibly strong, flexible bungee cords that connect bone to bone. They're all about stability. Then you have the tendons. These are what connect your muscles to the bones. They're kind of like the puppet strings that pull on the frame to actually create movement. So now that we know how this amazing joint is put together, how do we protect it? Well, that brings us to the practical part. This is your guide to keeping this vital joint healthy and strong for the long haul. Okay, this is basically your daily checklist for happy ankles. Wearing supportive shoes, doing some regular strengthening exercises, and always warming up, all of that protects those ligaments and tendons we just talked about. And hey, remember that crazy force we mentioned at the start? Well, keeping your weight in a healthy range directly reduces that pressure. These are simple things, but they make a huge difference. Of course, even with the best care, things can go wrong. Life happens. So being able to recognize the signs of common ankle problems is absolutely key to getting the right help fast and avoiding any long-term damage. All right, let's clear up the two most common injuries, sprains and fractures. They're not the same thing. A sprain is when you stretch or tear the ligaments, those soft tissue cables, usually from a sudden awkward twist. A fracture is different. That's a crack or an actual break in the bone itself, the tibia, fibula, or talus, typically from a fall or a much harder impact. And it's not just about sudden injuries. There are other conditions that can crop up. You have tendinitis, which is when those motor tendons get inflamed from overuse. You'll often feel that in the back of your heel. There's arthritis, which causes that classic pain and stiffness in the joint. And then there are things like gout and bursitis, which can cause this really sudden, severe pain and swelling from things like crystal buildup or inflamed fluid sacs. When you boil it all down, it comes to this. Your freedom to move, to walk, to run, to live an active life, it all depends on the health of your ankles. Understanding their structure and knowing how to take care of them isn't just a random anatomy lesson. It's essential for your mobility for years to come. So I'll just leave you with this one thought. Every single day, your ankles carry you through life, absorbing these incredible forces with every step you take. The real question is, are you giving them the support and care they deserve in return?